Boston, Massachusetts right now. And people are walking about the city, doing what they can, walking the babies, walking the dogs, just going about a normal, beautiful day here in Boston. There's so much to do, there's so much to see. But everything is pretty much closed down here, even on a Thursday. Even on a Thursday afternoon right now, it's about 4:15, 4:30, and everything is pretty much closed down. All the government offices, all the libraries, all social services, everything is pretty much closed down except, of course, the banks, the hospitals, and the local homeless shelters and homeless community services. So thank you to shout out to all the homeless community advocates and services, Salvation Army, American Red Cross, the gospel missions all around America. How are you doing?
You just spoke to me.
Good. Hey, can I ask you a quick question?
Don't take the phone. Right? No.
You're right there.
Go ahead.
You're right here.
No.
Can I ask you a question right quick? Is that okay?
Go ahead.
Come on. You can come on my blog. It's my YouTube channel.
Come on.
Okay, it's right here. You're on camera. So how do you think that how has the COVID-19 virus affected you and your family?
That's what I just did with my students. So for me to tell you that I'll be giving you my what's called
What's the biggest impact that the COVID-19? You said it was interracial problems?
No. If I asked you a question, I'll give you my intellectual property, which is worth a lot of money. So
that's a lot of money. Your intellectual property.
Okay.
Yeah, it's a lot. Thank you so much. Nice hat. So he doesn't want me to give him his intellectual properties. All right, so there's still a lot to be done here on the campus of MIT. There's a nice professor. I think he's a professor here at MIT. He has on his maroon cap. So I'm just going ahead and introduce myself. My name is Laqueen Battle. I'm a certified medical assistant, first aid responder. I have 3 class degrees, 2 degrees in Spanish and linguistics, and my first degree is in medical assisting and clinical medical assisting and administrative. So I'm here in the heart of Boston, Massachusetts, in West Boston, the campus of MIT. I am still doing some research, about to finish up this before the government continues its shutdown of the coronavirus here in the United States as well as all around the world. And major cities have been affected all over the world, in China, Beijing, Wuhan, and especially in Italy. Italy is going through right now its worst epidemic and its worst crisis because the heart of Italy is the fashion industry, it's commerce, it's trade, it's leather, it's goods production, it's export and import production as well. So please continue to pray for the people of the country of Italy because a lot of global trade is being done in Italy as well as in Europe. So a shout out to UK Prime Minister Boris Johnson, who is also trying to go ahead and get his country established and trying to figure out what is going on with this coronavirus COVID-19 epidemic as well. So it is a global health epidemic, but it can also be a global computer virus as well as a global technology virus. And time again, the question has been asked. Can you turn a computer virus into a human-made virus? Again, the question has been it's really old. Can you turn a computer virus into a human-made health virus? And yes, you can. It's really old. The question has been asked from the 80s and the 90s, and right now here in the millennial in 2020, yes, you possibly could make a computer into a human-made virus that can actually kill people all around the world. So there's still a lot of research to be done, and I'm sure that the STEM research, science, technology, engineering, and math research is being done all around school districts across here in America and around the world to encourage technology, to encourage science, to encourage math productivity with students, elementary schools, middle school, and high school students all around the world. So we do need more STEM research being done in grammar schools as well as all around the world. So thank you to the U.S. Department of Education for encouraging STEM research because this is really old. I can see there's a globe in front of me here on the campus of MIT, and many viruses, computer viruses, have infected the United States since the late 80s and the early 90s with IBM, with the computer wars between Caltech and MIT. There has been so much technology wars, it's ridiculous. They've written books about it, it's been on the media. Somebody can actually scam into government systems and take down a whole government just with a stupid computer virus. And actually right now it's being done here But I mean, we still have to keep our governments together. We still have to learn new ways and new methods of technology and productivity here and around the world. And again, I mean, history does repeat itself. History does repeat itself. We still have a lot to learn, as well as with the health virus, as well as encouraging mental health and mental health research and mental health productivity here in Boston and around the world, because we do need mental health. People are losing their jobs. The economy is going down. The Dow Jones stocks, global U.S. stocks are going down. There's a lot of issues with mental health, and because of the instability of the government with mental health, is leading to more depression and more suicide with people as well as around the world. So just because the government is shut down, more people are having claims. The claims for unemployment are going down, are going up. So unemployment claims are going up, as well as job growth and job creation is going down. So now that we have our current commander-in-chief, Donald J. Trump, in office with less than 6 months in office, and we do have a presidential race between Joe Biden, Bernie Sanders, and Donald Trump on the rise, we still have to focus on what's important in our communities and in our cities. What's more important? Health, maintaining our family, maintaining our homes, are creating job growth, creating job stability to increase the U.S. economy, to put down unemployment, to increase job growth and job creation. So there still has a lot to be done, and it's nothing old. I'm probably really slow. I'm probably really slow. I'm probably one of the last people to be really slow about this, but I still have a lot to learn. I still have a lot to learn here on the campus of MIT, because I've been exposed to computers all my life. We clean up the memory chips, we clean up computer chips all my life, and I had to do the cleanup, but I didn't want to do the job. So, but there still is a lot to learn, and I'm happy to be here in Boston, Massachusetts, to clean, fresh air. People still have masks on. People still are exposed to the elements, but it's normal. It's normal to see people from all around the world: Asians, Indians, Americans, Europeans, South Americans. People all around the world are here in Boston because they need the technology, they need the education, they need the productivity, but they're not going to let a government shutdown keep them from their jobs and keep them from creating job growth and education for them and their families. So there still is a lot to learn. I still have a lot to do. I still have a lot to do here on the campus of MIT and Harvard University here in Boston, Massachusetts, one of the most beautiful cities in the United States. Beautiful cities, a clean city, a lot to do, a lot to learn. And I'm just so sad that the libraries are closed. I can't get access to technology, access to educational resources, but I still have a lot to do. So you guys are still on? 8 minutes, great, okay. 8 minutes into this video. So it's a beautiful day here in Boston, Massachusetts. There still is a lot to learn. There still is a lot to do. And I'm happy to be here. I do have a bachelor's degree, and wondering if the pursuit of medicine, the pursuit of technology would be a great field to do for my master's degree, or maybe pursuing a doctorate in technology, health and information technology. So even though a global epidemic and a global virus can impact the whole world, we still have to pay attention and focus on our families, focus on our communities, focus on what needs to be done and what can we learn from the situation and not have it happen again. And of course, if it happened in the 80s, if it happened in the 90s, of course it's going to happen in the new millennium. And we still have a lot to do and a lot to learn. So I'm very happy to be here in Boston, Massachusetts. It's beautiful. Try to get people, they're going about, nurses and doctors and science people, running, walking the city. Beautiful day. Hi guys, how are you doing? Can I get your moment on my YouTube channel, Laqueen Battle? I'm a certified medical assistant. Can I get you a couple questions about the COVID virus? I'm not going to take any of your intellectual properties. Just a couple questions on the COVID-19 virus. Yeah, come in. Can you come in my screenshot? Come in my screenshot. I just need your voice. Come as close as possible.
We are trying to respect that.
Yeah, just come as close as possible. You can come as, okay, so how do you say?
You're recording this?
Yes, on my YouTube channel. Okay. Okay, all right. Okay. How do you think that the COVID virus is affecting you and your job and your family?
So I go to school right now.
What school do you go to?
MIT.
Okay, what are you studying at MIT?
Business.
Business? What kind of business?
Just business
has this new COVID-19 virus affected you and your pursuits of education?
Well, there's no school right now, so everything is remote. I'm originally from Trinidad and Tobago, that closed the borders, so can't really go home if I wanted to.
Oh, because the president has shut down travel, international travel.
Yeah, it's crazy.
Yeah, it is crazy. But you're still going back to school. When classes start back up again? Or is it closed for the entire semester? The 30th? Next Monday? Okay, well, and you're from Trinidad and Tobago? Okay, good. All right, well, thank you so much. Thank you. You have a good one. She's a gorgeous girl. She is a gorgeous girl. All right, thank you. So I have an MIT student here. He's an undergrad. He's studying business information technology, and he said that the COVID virus has impacted him in his studies, but it's only been a short-term goal. It's only been him short-term as well. But he's still continuing to pursue his educational pursuits with MIT, which is a great school to go to, a great school to be involved in. So he has a lot to learn, and it will not keep you back from pursuing your goals. Hi, how are you? Everybody's walking bikes here at MIT, doing what they can. And I'm sure we have a lot to learn here on MIT. People are walking the streets, walking their dogs, having fun here. It's great here to be a part of campus. And I'm just happy to be here. So we still have a lot to learn, a lot to do here. And unfortunately, schools are shut down, libraries are shut down, local government services are shut down, but it has not continued for people to be outside, skateboarding, roller skating. People are just enjoying life and enjoying the little services that they have of being out in the community. Oh, it's such a beautiful day. It's about like 35, mid-40s here. It's like a fresh San Francisco air, and there still is a lot to do and a lot to be a part of. So God, it's a gorgeous day. Gorgeous day here in Boston, Massachusetts. Time to get out there, do what you can. I mean, I've seen so many Mercedes and Benz. That's a beautiful Chevy Mustang. I've seen so many people. Hi, how are you? Good. Hi, how are you? Can I ask you a couple questions about the coronavirus? Okay, thank you. So it's a beautiful day here in Boston, Massachusetts, and we still have a lot to learn, a lot to be a part of. But people are a little shy because I'm in front of a restaurant that says Shy Bird. So we still have a lot to learn, a lot to do here, and it still has not stopped people from getting outside and enjoying the fresh air, taking a break off of work. Because you take a break off of work, a fresco, and the government will pay for it, will subsidize your time off in order to continue productivity and continue reinforcement of quality of life. Quality of life is very important. You have to improve quality of life because mental health does involve quality of life and quality of care for millions and millions of people all around the world. So quality of life is very important. Quality of life and quality of care. So quality of life and quality of care is very important. Somebody's coming through. Going to get more questions here. People are coming through. Beautiful Mercedes here in Boston, Massachusetts. Gorgeous. Hi, how are you doing? Good. I have a YouTube channel. Can I ask you a couple questions about the COVID virus? I know you're in a rush. Okay, he's in a rush. Okay, have a great day. Northwestern's a great school.
Thanks.
Chicago? Okay, so there still is a lot to be done here on the campus of MIT. People are out and about, riding their bikes. Hi, honey, how are you? Doing what they can, being about. And so it's kind of hard if people are kind of not stuck up and just going about their business, doing what they can. There still is a lot to learn. So I'm very happy to be here and involved here in Boston, Massachusetts. Life is going on, productivity is going on, and there still is a lot to be done, a lot to learn. And I'm very happy to be here. So shout out to all my family and friends, my coworkers from Advocate Healthcare, Christ Medical Center, Advocate Medical group in Chicago, Southside Chicago. Shout out to the AIDS Health Foundation in South Chicago, Hyde Park, and all the medical centers, all the hospitals, all the home health care centers I've been a part of, because if it happened before, like a global epidemic, it can happen again. So I'm very, very, very happy to be here in Boston, Massachusetts. Again. Hola, hola. ¿Habla inglés, sí o no? ¿Habla inglés? ¿No? Bueno, pregunta para mí, YouTube channel. Pregunta para la COVID virus. No, pregunta por favor. How has the COVID virus affected you and your trabajar? How? Cuenta. Oh, okay. Trabajar aquí. But you're still working, right? Puedes trabajar? So it's no. Come on, ven. Sí, para mi YouTube channel. Okay. So how has the COVID virus affected you in your work?
Yo quisiera estar en casa, pero no tengo cómo sostenerme, así que estoy trabajando ya que me dan chance. de
Entonces, más
trabajar.
o menos trabajar, más o menos. Pero necesito más dinero. So has the government supported you? ¿El gobierno ayúdate? ¿Sí o no?
Yo iba a decir que sí, nos van a ayudar, pero como nosotros no somos flexibles en este país, es difícil que
¿Tú eres americano, sí o no?
yo soy de El Salvador.
Pero es mucha asistencia para el gobierno de esa
Sí, pero yo oigo decir que el gobierno dio dinero para los más que tienen dinero. Entonces nosotros no tenemos, quizás lo van a dar, pero de último, ya, ni ya no vamos a estar quizás hablando.
Sí, hablando así todo. Sí, es más beneficio, pero el gobierno de Estados Unidos mira mucho ayudar para los especialmente comunitarios, para la salud, para COVID, para coronavirus. So, es más, es que más bueno que mira, aquí en Estados Unidos hay todo el país.
Yo tengo mucho tiempo de estar aquí, pero me he dedicado a trabajar. Traje a mi familia, aquí está. Así que yo le agradezco a este país, pero estamos viendo que no.
Pero aquí en los Estados Unidos tienes que trabajar, hay mucha ayuda, todo, especialmente para la salud, la seguridad, aquí en Estados Unidos. Ok. Gracias por tu
Me llamo Andy.
Andy. Ese se llama
Saluda a mi familia.
Gracias por todo lo que tengo el día.
Bueno,
Gracias por todo lo que tengo el día. Okay, so pretty much he was saying that there's much support systems and much it's better to live here in the United States where you get more opportunities and more support systems. There's more work here in the United States. There's more, kind of off and on here, so it's better here to get more opportunities and more health services, more work, more health services support here in the United States than it is in other countries. So actually that's why people come to the United States, just for the health services, health insurance, as well as getting more job opportunities here in the United States. So again, it's better here in the United States, but to actually have the American government system shut down, that is an issue. That is an issue that we do need to work on here in the United States. To actually have immigrants and people from all over the countries, from the Middle East, from South America, from Mexico, from Canada, come here to receive our healthcare services, our health insurance, Medicaid, Medicare, and not to be able to receive their services because the government is shut down. That is the issue. It brings down job growth, it brings down job productivity, and it takes out the export and the import services that the U.S. government does need, especially in times of health crises, as well as health crises that we're going through right now. So there still is a lot to learn. There still is a lot to be done here in the United States. So we still have a lot to learn. But people continue to pour through our borders, even though our borders are shut down between Canada and Mexico. Our people continue to come in here to continue to work, continue to do what they can do to receive services, to leave their home countries and their home countries passing behind. People will still continue to come here, even though our borders are shut down, our northern and our southern borders are shut down. People will still continue to come here in the United States and around the world to get our American way, our American quality of life. There still is a lot to be done. Comprende un poquito para el español, pero necesito trabajar en mi español. So, la gente de otros países ya puedes continuar y viajar y borders de Estados Unidos, ¿ok? La todo el día, inmigrantes y todos los todas las personas de todo el mundo que tienen la oportunidad en mover y viajar en los borders de Estados Unidos a todos los días. And a coronavirus or anything will not stop, no queda data, dice servicios, no queda data, people, inmigrantes y Muslims y people from the Middle East, it will not stop it. No queda data, it will not stop them from coming here and receiving the services. Continuar and receiving the servicios de los Estados Unidos. Because the United States need our services. Estados Unidos necesitan los inmigrantes, Estados Unidos necesitan los inmigrantes de méritos y todo. We need the services and we need the advice, we need the research, we need y todo los inmigrantes, and it still should not be a problem. It still should not stop the United States from receiving the services of immigrants. So, so gracias por la conversación con el Señor de El Salvador. I still have a lot to learn. I still have a lot to do. Here in Boston, I have all my junk between me, but I'm very, very, very happy to be here in Boston, Massachusetts, to learn, to live, and to have a quality of life. The quality of life here in Boston is great. People are out and above, having a great, healthy way of life and doing the very best that they can. So, if you're there in Boston, and muy bueno, I love Boston. It's beautiful, as well as moving more East Coast, going to LA, going to Dallas, back to Dallas, my family, going to LA, see some more family, Chicago, South Side, New York, Virginia, DC, all around the world. People are still going through the same thing, but it has not stopped them. All around the world, people are still going through the same thing over and over again, but it has not stopped them from living a life, the quality of life that they deserve and that they need. So, gracias por todo para mi familia en todo el mundo, en todos los Estados Unidos, as well as necesito los servicios de inmigrantes en México, en Canadá, as well as todo el mundo. Estados Unidos, el gobierno de Estados Unidos necesita ayudar a los inmigrantes de México. Los inmigrantes de México, establemente, el gobierno de Estados Unidos. We have to continue to support immigrants here and around the world. We need them. We need life, as well as they make up our government, make up our system, and make up our quality of life here in the United States, as well as our healthcare system. We need immigrants from Saudi Arabia. We need immigrants from Africa. We need immigrants from all around the world, and they still will not stop us from doing what we can here in the United States and all around the world. So this is Laqueen. Está Lorena Batalla aquí in Boston. I'm having a great time here in Boston, and I continue to pray for me. I'm trying to set up my Cash App and all my donation links to continue the research I have here on the East Coast, as well as pretty much get established, get back to school, get a job, and get a roommate, a place to live, and just take care of and provide for myself. So I love you. Me quiero, toda mi familia en todo el mundo en el world está bien. Mi familia es militaria. So, gracias por todo. Thank you so much. Mi amante y todo mucho. So this is Laqueen Valley here from Boston, Massachusetts. I love you guys.